Hi, I am Raghad Alotaibi. Today we will talk about a case which is reflect the swim lane process of a patient who had a small breast tumor. They decided to remove it by a surgery which covered 9 parties, included the patient, as we see on the graph. However, the patient, who was a registered nurse, detected 2 errors during the treatment process. The first error was by the surgeon. He intended to employ a needle locator to identify the location of the tumor. The surgeon has failed to forward an order to that effect to the hospital. The patient identified the omission prior to the surgery, so no harm occurred. The second error was a pathology report. It was a typographic error when he wrote that the tumor was 1.6 millimeter while it was 1.6 centimeter. The harm avoided by a phone call to confirm the correction. And here is a quote of Brian Tracy. He says, "The true measure of the value of any business and its management is the performance."
Hi, I'm Shahid Al-Haik. I will discuss the first question. Who or what organization is responsible for the process from start to finish? What are the implications for managing and improving the treatment process? First, the hospital management is responsible for the process because every step or process occurs with their consent. The improving and management of the treatment process will decrease the defect and protect the patient. Some implication for managing and improving the process, like the high level of management, will increase the efficiency of the process. Also, use of technology in improving the process will decrease the error. Moreover, the improving and management will make the management be able to know their defect.
Hi, I'm Atheer Shabanat. Today I'm going to answer the second question, which says which process steps should be standardized and which process should be more artistic. And we should explain that answer. Before answering, I see it's best to explain what is standardized and what is artistic first. Standardized process is a strategy focused on establishing a set of validated and accepted procedures that define the best and most reliable practices to be carried within the company. At the same time, it's a tool that allows the maximum use of human resource and technology while maintaining the production rhythm and adapted to customer needs. For the artistic process, it's a variability in the process and outputs. Based on those informations, we figured that the best processes to be standardized are the pre-admission, appointment, and the develop send receive process, scheduling for the order, mammogram process, and physical, because they lead to all the same results and their process do not require a lot of flexibility. Unlike surgery, treatment plan and the treatment itself, they differ and depend on the patient, and they value variability because they use different approaches on each patient.
Hello, I'm Nadia Husseini. I will answer the third question shown in the video. After implementation the Six Sigma in the hospital supply chain, we analyzed some solution that helps to improve the hospital system. The first error was a miscommunication in identifying the location of the tumor, but it's good that the patient realized the mistake before the surgery. The second error, there was a mistake in typing of a tumor size by a pathology laboratory when they use a millimeter instead of centimeter, which could lead to a serious problem. But luckily, the hospital avoided this mistake. So, we must collect data from both regions. For example, in hospital surgeon, we placed all order verbally, which increased the chances of the error. We think that it must be a mediator between the surgeon and the hospital to eliminate this error, such as an email where they can place the order for a specific surgery, which will direct it to the department. And for a pathology lab, they should get an updated version of the software, which will identify the cause on itself after scanning the data of the test.
Hello, my name is Shahid Al-Khlewi. I will talk about the conclusion and the recommendation. An improvement on a daily basis will help the hospital to maintain its standards and quality of treatment provided to their patient, which will lead them to stay in the industry as a strong player. For the recommendation, we think that to prevent these errors from happening again, there should be a proper team to overlook all these tasks are done properly or not. For example, emails between surgeon and surgical tools department should be copied with a senior surgeon to double check all the lists. Also, it would be a good idea if they have continued training in hospital procedures that will help to prevent future errors.
We hope you enjoy watching our video. If you have any question or recommendation, please feel free to put them in the comments below and we will willingly answer them. You will have the link of the PDF file in the description box below in case you need it. Thank you and goodbye.